Your bones are breaking right now and you might not even know it. Hi there, wonderful seniors. I'm here with some life-changing information that could save you from a painful fall or a broken hip. If you're over 50, this video could be the most important 15 minutes of your day. Before we start, do me a huge favor. Hit that subscribe button and ring the notification bell. Why? Because I share vital health tips like this every week, and YouTube only shows my videos to subscribers first. Plus, share this with someone you love, your spouse, your children, or that neighbor who's always looking out for you. Today we're talking about osteoporosis. Think of it as your bones becoming like old dry wood instead of strong, fresh timber. And I'm going to show you the 5 warning signs that most doctors don't tell you about until it's too late. Warning sign number 1. You're getting shorter. The first warning sign sounds almost funny, but it's deadly serious. Are you shrinking? I don't mean feeling small. I mean actually getting shorter. Here's what's happening inside your body. Your spine is made up of 33 building blocks called vertebrae. Think of them like a stack of donuts. When osteoporosis hits, these donuts start cracking and collapsing, just like stepping on a real donut. When they collapse, you get shorter. Now, everybody loses a little height as they age, that's normal. But if you've lost more than 2 inches from your tallest adult height, or if you've lost more than half an inch in just 1 year, your bones are screaming for help. Let me tell you about Margaret, a 68-year-old grandmother from Ohio. She noticed her pants seemed longer, and her grandchildren started teasing her about shrinking. She laughed it off for 2 years. Then one day, she bent over to pick up her newspaper and felt a sharp crack in her back. She had fractured 3 vertebrae without even falling. The doctor told her she'd been walking around with weakened spine bones for years. Here's how to check yourself. Stand against a wall with your back flat. Have someone mark your height with a pencil. Do this every 6 months. If you're losing height faster than 1/4 inch per year after age 70, or any noticeable amount before 70, see your doctor immediately. The science behind this is fascinating, but frightening. Your vertebrae are mostly made of spongy bone, which is like the inside of a chocolate bar. Lots of tiny holes. This spongy bone is the first to weaken with osteoporosis. When it gets too weak, gravity literally crushes your spine, 1 vertebra at a time. Warning sign number 2. A curved or hunched back. The second warning sign is developing what doctors call a dowager's hump, or kyphosis. But I call it the question mark back, because your spine starts looking like a question mark from the side. This isn't about bad posture from sitting at a computer. This is your spine bones literally crumbling and collapsing forward. It's like a tower of blocks where the bottom ones are getting crushed. The whole tower starts leaning forward. Here's the devastating part. Once this starts, it creates a domino effect. The curved spine puts pressure on your lungs, making it harder to breathe. It squishes your stomach, making it harder to eat. It changes your balance, making you more likely to fall. And falls with osteoporosis often mean broken bones. Let me share Robert's story. He was a proud 72-year-old former construction worker. He started noticing his shoulders rolling forward and his head jutting out. His wife kept telling him to stand up straight, but he couldn't. Within a year, he was so hunched over he couldn't look up at the sky without straining his neck. The doctor discovered he had severe osteoporosis and had suffered multiple tiny fractures in his spine that he never even felt. The scientific explanation is heartbreaking. When your spine vertebrae collapse, they collapse forward, not backward. It's like stepping on the front of a box. The back stays up, but the front crushes down. This creates the hunched appearance. And here's the cruel part. Each collapsed vertebra makes the next one more likely to collapse because it changes the weight distribution on your spine. If you notice your clothes fitting differently across your shoulders, if you can't stand as straight as you used to, or if people comment that you're hunching over, don't ignore it. This could be your bones crying for help. Warning sign number 3. frequent bone breaks from minor accidents. Warning sign number 3 is breaking bones from things that shouldn't break bones. We call these fragility fractures. If healthy bones are like fresh green branches that bend before they break, osteoporotic bones are like old dry twigs that snap at the slightest pressure. Here's what I mean. If you fall from standing height, just tripping on a rug or missing a step, and you break a bone, that's a major red flag. Healthy bones should be able to handle a fall from your own height. If they can't, they're telling you they're in trouble. The most common fragility fractures happen in your wrist, spine, and hip. Let me paint you a picture of how serious this is. If you break your hip after age 65, you have a 20% chance of dying within 1 year. Not from the break itself, but from the complications. Blood clots, pneumonia, infections. It's like your body's defenses are already weakened, and the fracture becomes the straw that breaks the camel's back. Here's Sarah's wake-up call. She was 59, active, walked every day. She was getting out of her car in a parking lot, caught her foot, and fell sideways onto her wrist. Snap! Broken wrist. The emergency room doctor said, "At your age, falling from standing shouldn't break your wrist. We need to test your bones." Sure enough, she had osteoporosis and didn't know it. The science here is crystal clear. Healthy bone can withstand 12,000 pounds of pressure per square inch. That's like balancing a car on a quarter. But with osteoporosis, your bone strength can drop to just 4,000 pounds per square inch. Suddenly, your bones can't handle normal life stresses. Think about this. Coughing violently, sneezing hard, or lifting a bag of groceries shouldn't break ribs or vertebrae. If they do, your bones are desperately trying to tell you something. Warning sign number 4. Severe back pain that comes and goes. Warning sign number 4 might surprise you because we often blame back pain on getting older or sleeping wrong. But sudden severe back pain that comes out of nowhere could be your spine bones fracturing. Here's the tricky part. When a vertebra in your spine cracks from osteoporosis, you might not even know it happened. It's called a silent fracture. You might feel some back pain for a few days or weeks, then it seems to get better, but your bone didn't heal. It just stopped moving around. The pain pattern is very specific. It's usually sharp, located in one spot on your back, and gets worse when you move or even breathe deeply. It might feel like someone stuck a knife between your shoulder blades or in your lower back. The pain might last for weeks, then gradually fade, but then it comes back in a different spot. Here's what happened to Frank, a 71-year-old retired teacher. He woke up one morning with excruciating back pain. He thought he slept wrong. The pain was so bad he could barely get out of bed. After 2 weeks, it got better, so he forgot about it. 3 months later, it happened again, but in a different spot. This time, his daughter insisted he see a doctor. An X-ray revealed he had fractured 2 vertebrae and he had severe osteoporosis. The medical explanation is sobering. When your vertebrae are weakened by osteoporosis, normal activities like bending over, lifting, or even coughing can cause tiny cracks or complete fractures. These fractures cause inflammation and muscle spasms around the broken bone, creating intense pain. But because the bone isn't displaced, it's not like breaking your arm where you can see something's wrong. Here's the key difference. Normal back pain from muscle strain or arthritis usually improves with rest and gentle movement. Osteoporotic fracture pain is sharp, severe, and gets worse with any movement. If you have sudden, severe back pain that doesn't improve with rest, especially if you're over 50, don't tough it out. Get it checked. Warning sign number 5. Receding gums and loose teeth. The 5th warning sign happens in your mouth, and most people never connect it to bone health. If your gums are pulling away from your teeth, or if your teeth are becoming loose, Your jawbone might be weakening from osteoporosis. Think about it this way. Your teeth are held in place by your jawbone, just like fence posts are held up by the ground. If the ground around the fence posts washes away, the fence becomes wobbly. Same thing happens with your teeth. When osteoporosis weakens your jawbone, your teeth lose their foundation. Here's the connection most people miss. The same process that weakens the bones in your spine and hips also weakens the bone in your jaw. Your jawbone is constantly rebuilding itself, just like all your bones. When osteoporosis disrupts this rebuilding process, your jawbone starts thinning out. Let me tell you about Dorothy's experience. She was 64 and started noticing her gums were pulling back from her teeth. Her dentist mentioned she might need gum treatment, but Dorothy's daughter, who's a nurse, suggested she also get a bone density test. Good thing she did. Dorothy had significant osteoporosis. Her dentist later told her that jawbone loss often shows up before we see it in other bones. The scientific connection is remarkable. Studies show that women with osteoporosis are 3 times more likely to experience tooth loss than women with healthy bones. The jawbone, especially the part that holds your teeth, has a lot of spongy bone, which is the first type of bone to weaken with osteoporosis. Here are the warning signs in your mouth. Gums that are pulling away from teeth. Teeth that feel loose when you touch them with your tongue. Changes in how your dentures fit. Or your dentist mentioning bone loss during routine x-rays. Don't ignore dental problems thinking they're just part of aging. Your mouth could be giving you the earliest warning sign that your bones need help. Here's why recognizing these warning signs could save your life. Osteoporosis is called the silent disease because by the time most people discover they have it, they've already broken a bone. And breaking a bone when you have osteoporosis isn't like breaking a bone when you're young. When you're young and break a bone, you heal and get back to normal. When you have osteoporosis and break a bone, especially a hip, it can end your independence forever. 40% of people who break a hip never walk independently again. 20% end up in nursing homes permanently. But here's the hope. If you catch osteoporosis early, you can slow it down, stop it, and even reverse some of the bone loss. There are medications, exercises, and lifestyle changes that can rebuild your bones. But only if you catch it before the first fracture. Let me quickly recap those 5 warning signs that could save your bones and your life. Number 1. You're getting shorter, losing more than 2 inches from your peak height, or more than half an inch in 1 year. Number 2. Developing a curved or hunched back that you can't straighten out. Number 3. Breaking bones from minor falls or accidents that shouldn't break healthy bones. Number 4. Severe back pain that comes and goes, especially sharp pain that gets worse when you move. Number 5. Receding gums and loose teeth that could signal jawbone loss. If you have even one of these warning signs, please see your doctor and ask for a bone density test. It's a simple, painless test that could save you from a life-changing fracture. Don't wait until you break a bone to find out you have osteoporosis. Your bones are talking to you right now. Are you listening? If this video helped you, please give it a thumbs up and share it with someone you care about. Subscribe for more life-saving health tips, and remember, your health is your wealth, and your bones are your foundation. Take care of yourself, and I'll see you in the next video, where we'll talk about the foods that can actually help rebuild your bones naturally. Until then, stay strong, stay healthy, and pay attention to what your body is telling you.